Hello and welcome to the Sky Stage here at 4 Years From Now. Welcome back to those who were here this morning as well. I can see a few familiar faces in the audience there. But it is great to have you. I know there is a lot going on out there. So the fact that you've chosen to spend a little bit of time with us to talk about digital health is amazing. So thank you for being here. Just need to take a moment to thank our sponsors, AstraZeneca, and our co-organizer, ECH Alliance, the Global Health Connector. So thank you very, very much. Now, this afternoon, we are shifting our focus towards the patient. And we've got two great panel discussions on the way, one around empowering patients, the other around healthy aging. But before we get to that, we do have a presentation for you. And here to take you through this, please join me in welcoming on stage the Executive Vice President and Managing Director of Southern Europe for Siemens Health and Ears. Please put your hands together for Saurabh Pagari. Have a great session.
Hi, everyone. You can hear me okay, right? Perfect. It's Siemens Health and Ears. Louis, but you tried your best. Very happy to be here, second here on the stage, sharing my passion about healthcare, about the role technology plays in taking healthcare to the next level. And today I wanted to talk about a very, very interesting topic, which is future of healthcare and how we can make it accessible for everyone, everywhere, in a sustainable way. You guys are coming out from lunch. So let me wake you up a bit. Who would like to be on that island for a vacation? See, you make good choices in life, right? But there are people who actually live on such islands, like this Greek island, for their living. This is Nuno. Nuno is 43 years old. He's a fisherman. He wakes up one morning. He's unable to move his arm. He cannot recognize sensations on one side of his face. Guess what's happening? Nuno is suffering stroke. Now, if you're back on that island, when there is no healthcare facility, no real expert, and you get to such a situation, what do? You pray to the Almighty that this thing happens, and then you call the ambulance. An air ambulance can take hours to come, and then it can take hours to take you to Athens and get you the medical care. And for those who know stroke, the one thing you don't have in that is time. We call it, in stroke, we call brain. So time is brain, time is life, because every single minute that you miss, you have millions of neurons dying. However, that's where technology helps. We were able to get Nuno the first diagnosis only through remote consultation. He could be given medicines which could retard the progress of the damage to the brain cells, and then through helping the local healthcare providers, through experts from Athens, he was able to get his cure. So that's the power of technology in making healthcare accessible. But healthcare, when you think about healthcare, healthcare and health technology, it's not only about innovation. I always say it's about saving lives. But one has to also understand that that's not a small deal. Why? Because there are many, many challenges that we are facing today. If you think about the biggest challenge that we have, is provision of healthcare to the planet. And the planet, which represents 8 billion strong people. 8 billion strong people with equal healthcare needs is what we strive for. But what do we have today? We have only 25% of people who have access to what we would call as quality healthcare. Only 25%. And more than 50% of population actually lives in rural or remote part of the world areas where the high-end technology doesn't reach. That's challenge number one. There are 4 of them. Challenge number 2. Even if you have technology, the question is who will deliver the care? By 2030, we are going to miss 11 million healthcare professionals in the industry. 11 million. Just to put this in perspective, that's all of Portugal or Sweden, more than that. So we got to figure out not only how to get the technology there, but we got to figure out how to get the skill set there and scale the skill set so that those technologies can be enabled to serve the patients. Challenge number 3, which is also now the theme of the conference, sustainability. Do you know, actually for me, it was a bit of a surprise when I came to know this figure. 10% of energy consumption in Europe is in healthcare. That's a huge number. It's not a steel mill, it's not an industry that we are preparing, but still, just look at the energy footprint that it has. And we have to figure out that if only providing a section of that population costs us this much of natural resources, what would it mean if we have to get it to everyone? So this is a practical challenge number 3. Practical challenge number 4, and we all know this, aging population, right? We are living longer, and worst part is we are not living healthier when we are living longer, which means we need more healthcare to support people. And this will create extra burden on resources. That creates an extra burden on ability to provide that care for which we are missing people. So to sum it up, I think when we talk about healthcare access and using technology to do it, it is definitely not a challenge for faint heart. Question, how can we use innovation to do that? And I want to share with you some practical examples now. And the reason I did this also last year when I was speaking on AI, because I believe that seeing is believing, and when things happen in action, people think it is possible. And thinking about possibility is the first step towards making something really possible. So what is the possibility? Let me present you this case, city of Sao Paulo, yeah? Almost 12 million people. Huge cities, people who have been there, they know it's not easy to survive in big cities like this until and unless you have good infrastructure. And one of the good part of infrastructure is healthcare infrastructure. What did we do here? We helped to connect the whole Sao Paulo healthcare system through a digital backbone and build an analytics layer on top for them to understand what are the healthcare needs of the population. With that, we could look at the electronic health records and figure out who are the patients who might be prospective for certain cancer diagnosis, who might be the patients who might actually be at the risk of developing diseases like strokes, and so forth. The good part of that is when you start to put that in action, you start to see what difference it creates. Yeah, and I won't go into the detail, but I will be more than happy to take you through that. I think this is working, yeah? It's 6 months that this is now live, and you see already the impact of this. We have been able to avoid 28 stroke episodes, 600,000 telemedicine consultations. Remember, accessibility? Now you don't have to drive to your GP. You can just call, get on phone. It's good for you, good for environment, and good for the GP. They are being able to be productive and help you without being stressed about it. At the same time, look at the number of emergency visits reduction. And emergency visits are one of the biggest bottleneck in the healthcare system. Somebody here from UK? No. So in NHS UK, I can say whatever I want now, but I won't. NHS in UK, they have a problem that the emergency waiting times can go from couple of hours to couple of days, talking about emergency. You don't want to be in a healthcare system like that, right? You want to be in a healthcare system that can respond. The same thing, so this was Sao Paulo. Let me bring it closer to home. Another good example where we are putting technology to use to make quality care accessible. This is here in the backyard, a great institute, Valdebron. We are working with them to change the paradigm of stroke care. we want to make sure that if somebody suffers stroke, that we should be able to provide intervention to them within the first 30 minutes of their arrival at the hospital. That's a big, big challenge, and we want to do it across Europe. So there is an initiative, it's called Umbrella. It's focused on building common protocols across several European key stroke centers, working together, developing not only common protocols, but algorithms using the local patient data with our infrastructure in terms of AI development. Yeah? I'm super happy. Waldebron has been at the forefront in reducing their in stroke, it is called door to needle. So the point at which when the patient shows up to the point where you can actually start the procedure on the patient to take out the clot. And they have been able to reduce it to 1/3 from 72 minutes to now almost less than 28 minutes, which is an amazing, amazing advance, because that means better quality of life, less disability after an episode of stroke. The third example is on AI. And AI, when put to a practical use of one of the most prevalent cancer in women, which is breast cancer. If you look at when we have implemented AI, today we know that that is already helping in reducing reporting times, helping in better diagnosis. Even you see here, yeah, in terms of making sure that we have positive detection rates and not false positive, AI can do a better job. So these are practical examples where today, even today, it is making a big difference. Now, remember I told you something about missing healthcare staff? So the question is, can we have something which enables a staff to work from everywhere? So if you think of big machines like CTs and MRIs, yeah, these machines require people to be sitting there to operate it. Of course, in future, they would be automated as well, but you still need medical and clinical staff around it. So we have implemented something called remote scanning, where using our single virtual cockpit, sitting thousands of kilometers apart, somebody can do an expert, highly complex scan on an MRI machine, which is a highly complex medical device, yeah, to work on. So I'm super happy that when you think about all these innovations, it's there. The question is also, are they sustainable? Are we doing anything to make it sustainable? And I take two quick examples. One, I talked to you about MRI. Now, people who have gone through an MRI exam know it's very chilly in there, and it makes a lot of noise. It's also because it's working on a principle of superconductivity, which is creating magnetism. Sorry for being geeky. But that requires ultra-cooling of magnets, which require helium, one of the rarest of the gases available on Earth. Of course, one day we will probably get it from Moon, but that day is still far off. And one MRI can use 1,500 to 2,000 liters of helium in order to keep working on its life cycle. What did we do? We put the technology so that with 0.5 liters, that's less than a water bottle, of helium, you can run an MRI machine for life. And we already revealed it last year in one of our biggest trade shows. Today, this is the most sustainable MRI machine which is available in the market, helping to really save planet from the crisis of unsustainable healthcare operations. Yeah? However, let me say something. Yeah? I say we have all these innovations. The question is now not about innovating only. The question is about adopting. And that's why I'm being a bit controversial here. Apologies to all the marketeers here. I am your friend. I have nothing against you. But honestly, we have talked about AI, Gen AI, sustainability for easily a decade now. Back in 2015, we were talking about it. Today, we are in 2025. We have to ask, why are we still talking? Why are we not moving forward? We are moving forward in bits and pieces. But this requires a different momentum now. And what will bring that different momentum is when we invest in things which create real clinical value. It is super important that we don't create innovations which are cool, but neither have value for patient nor for physicians. The second thing, it's about integration. If any one of you is a doctor, he knows how complicated their life is, and their biggest enemy is their own IT systems. Because nothing is integrated with anything else. You don't want to have another tool sitting there and making them work on that. Integrate it into their workflows. And last but not the least, scalability. Remember, 8 billion people deserve an absolute high quality healthcare, which means we can't have 8 billion different solutions. We need few good, scalable solutions, and that's what we need to focus on. That's what we will go there. And for me, the big question is, are we ready? Are we ready for that transformation? You guys are innovators. You guys are critical thinkers. You guys are also adopters. Think about it. Are you ready for that transformation? Because for me, that is what will make the big, big difference between whether we will have it or not. Thank you so much. Thank you for the opportunity. It has been a pleasure, and I wish you a wonderful, wonderful MWC this year.